It was very different. I was a little naughty.
Welcome to another episode of Pearls of Wisdom in association with Pearl Dental Clinic. And today we have Dr. Fathima with us. Hi Fathima, how are you doing?
Hello, doctor.
Yes.
Thank you for having me today.
Yes. Can you give a very brief introduction about yourself?
I'm Dr. Fathima. I'm from India. I've been practicing dentistry for roughly about 7 years. In Dubai, I've been about maybe 2 years now. It's been really, really good. Very, very, very different from what we do in India. It was like a rebirth. It almost felt like that. But now I've caught up. Feels very, very good.
So how was your days at the college, university days?
It was very different. I was a little naughty, but it was good.
It was good.
I had my side of fun. I had my side of academics as well.
So what is the naughty side? Like what are you doing?
Naughty side,
What
I
are you
used
up
to miss a lot of classes, but I used to catch up when I needed to. I used to pull all-nighters right before my exams. It was very chaotic, but you have to do what you need to do. But in school, it was entirely different. In school, you're more of a child. You want to be the teacher's pet.
Yes.
But when you enter university, you meet entirely different people. There's a saying that says, tell me who your friends are and I'll tell you who you are. So that transition happened to me when I was in university.
Have you felt like you are a completely different person from school to
Very,
university level?
very, very much so. Very much so. And that transition happened even when I finished university. I became a different person. And as you move to different places, as you make new friends, now I feel like I'm a whole different person than what I was in university. Now I think back and I'm like, what was I doing? Why did I do that?
Yeah, when I was in the university, the way that I was studying is like, oh my God, if I would have done the same education at school level, maybe I would have been a school topper or something like that, you know. And when you talked about all-nighter, that also came to me. Study the whole night and without sleeping, went directly to
I know. Me too. And I would struggle to stay up during the exams because I need to finish and you only get 3 hours.
Yes.
You need to finish because you know everything and you're struggling not to sleep because you pulled an all-nighter. So it has to be worth it.
Yes, exactly. How was it your early days in India practicing?
Early days in India, it was a bit of a struggle because what they don't tell you in university is what you practice in theory is not exactly what you put into practice.
Definitely. I think this is worldwide. It's not only just for India.
Yes.
Like I've met so many doctors around the world and they all have the similar feelings to what they have experienced during their university level, and when they come directly to the practice, it's totally different.
Entirely different. And suddenly you're in the clinic and people tell you, no, this is not what you do. This is not how you elevate. And it throws you off.
Yes.
So you are self-doubting. All of that also happened, like a lot of self-doubt. So did I learn wrong? Was I not in the right university? What happened? But then you catch up. You see others, how they practice on a day-to-day basis. Similarly, that's exactly what happened every different clinic that I worked at.
Okay.
Yes. But again, it is a learning experience and it molds you also.
After the university, you are like geared up, right? You want to do the practice, like the big thing.
Yes, you're like,
bring
it on.
The first clinic that I went to, there was just this one doctor and he had 5 dental chairs. And he just goes from one chair to the next and to the next, and then he just rotates around. So by the time he comes back to the next patient, the nurse has his instrument set up, everything done.
Wow.
And then he just does the treatment and then remove the gloves, goes to the next. He always does his treatment standing.
Okay,
no sitting down. And he had a long queue of people waiting outside. This was like, for us coming from a university to see this was like, okay, how do I fit in?
Yeah.
You know, and when I start doing this, like he came round to me and said like, oh, not done yet? Okay, then he went second round, you're still here with the same patient.
Yes.
Okay, then move out. And then so that was, every step was a learning curve. And eventually I landed up in a very good clinic, and most of which what I practice today is that laid the foundation. Because that doctor, he said, you are not touching any patient without explaining everything in detail. So that's where I got that from. And that stuck with me with all these years. I would say that was the founding principle of my practice. Like, that's where it all began. He was very strict on that. Like, you need to explain first and then do the procedure. That helped me a lot.
I'm sure your patients love that.
Yeah.
You gain their trust even before you start anything, and that's lovely. Yeah.
Now tell me, what brought you to Dubai in the first place?
Basically, my husband is from Dubai, so that is how the move happened. And I completely moved only during the period of COVID. That's when I decided, like, as all the clinics were shutting down, your position is not definite. You never know, are they going to call you back in? What is happening? Everything was so unsure at that time. So I decided, like, okay, let's pack up. We need to leave right now. And that's how I landed in Dubai. When I came to Dubai first, it was in 2015. And back then, position of a dentist was entirely different. It was not as saturated as it is today. So fast forward to 2020, so whole new world. And plus it is just right after COVID. Here as well, a lot of clinics are shutting down. You never know what is going to happen to you. So to start off here, again, it was very much a challenge.
How was it finding a job there, your first job?
Actually, a lot of people are going to agree with me. Your first job in Dubai will be the toughest to find. What you did in India does not matter. Here you are born new all over again. You start from scratch. So that was very, very difficult. It gets a little easier if you have some connections. That way, it definitely does. And another thing, I'm not sure if you're going to agree with me on this, it is not as easy for women as it is for men.
I would say men will have a different version.
I know, but I've heard this from a lot of fellow female dentists as well. They've had a similar experience, maybe not for all nationalities. Maybe from where I'm coming, it is almost always the case.
Okay, so what I heard from the male doctors are, most of the female doctors over here are sponsored by their husband, by their father, by someone other. For men, there's no sponsorship. So it becomes a lot more easier for the clinics to hire women because there is no overhead cost of the visas and labor contract and all that. Labor contract is there, but not like a huge expense on the clinic's part. So they favor mostly women. And for the male doctors, it becomes more challenging because for a clinic to hire a male doctor, they need to have the whole process in. This is long before golden visa, long before that. So it's a very beginning. So this is what the male version of getting their first job is.
True that. This is more from obviously from the management side. This is very true. I've heard this as well. It is easier to hire not just a dentist, but anybody in any sector. It is easier for the management to hire a female because of these reasons. It is very easy. But my point of view was that not just the management, it also comes from certain other people as well. Somehow, in some way, not everyone, but some people, they tend to take a male doctor more seriously than a female.
For a patient's perspective, well, kind of changes from time to time. That's a whole different concept. Like, this is how the management sees it.
True.
So when the management sees something, they look at the expenses side first before hiring someone. But in very well established clinics, they may have a different take on what would be the right candidate. But for here at Pearl Dental Clinic, we don't look at those. We basically look at the talent, how they speak, how confident, do they have the confidence to speak to the patients, and within themselves. This is the most primary. All the doctors are actually good. Their skills, very good. But how do they perform in the clinic is very crucial. You may be a very good clinician, but if you cannot communicate very well with your patients, even then the patient may not accept you. Whether you are a male or a female, it doesn't matter. So how's your first job like?
My first job was a very good teaching experience for me. It was, I'm trying to put it nicely. It was actually very good. I must be very, very grateful and very thankful because they probably did not find it as quickly as I did, because I had my circle of friends who have been struggling way before I did, but luckily I found it faster than they did. But after I landed the job, I realized that maybe I should have waited a little longer, but it was still a very good experience. In a way, it was not it was more of a con for me because it was not my kind of job. That is what I felt.
It depends on how you take a look at it. Now, for me, my first job was in the heart of the city. Like it is inside Dera, knife area, where I get everyday workers, daily workers. The maybe it's a restaurant worker, laborer, or work for someone like with no money or very little money, right? But the work that I enjoyed the most actually is because when I modeled that, like I need to explain everything before I can provide the treatment, and they were very surprised. There is one doctor who's sitting down and talking to them, explaining what they have and what the treatment should be and how to take care of themselves, and they never experienced this before.
Any other doctor.
That changed them, and I had these patients hugging me. They come direct from work, sweaty and everything, but they're just like, they're so emotionally moved that they just want to hug me. But then when I moved from one clinic, then I moved to Bardubai, a clinic in Bardubai. Same story, similar kind of crowd. Again, the same thing happens. I enjoyed every part of it. Whenever I look back, I always have to thank them for making me who I am today, because they showed me a lot of what it means to be a good doctor, to sit down with them, to talk to them, and how they felt about it. That inspired me more to do a lot more for them and for many more patients that's coming. But at the same time, I should say, in the clinics that I worked, they didn't like it, because I'm spending a lot of time with my patients. I'm educating them a lot. So they all wanted to know what I'm doing so much. Okay. And I give my patients a very clever treatment in a way that will lessen the time, increase the performance of the treatment, plus lower the budget. So I try to work around a way that's more definite treatment, without crossing over anywhere, and provide them direct, straightforward treatment that actually cuts down their budget a lot. But the management had a problem with that. Because I'm not making enough money for the management. But what I wanted to tell them always, I did tell them, my techniques is what makes me work properly. And for sure, the word of mouth will spread. It's slow, but the word of mouth will spread. And then after some time, you will start to see there's a lot of patients coming to you. They didn't have time to wait and watch for that.
This is actually what happens when you work for a corporate. They don't, they only speak numbers. For them, numbers are what matter. At the end of the day, they don't see how many good patients you've had, how many non-invasive procedures that you've actually done. But in terms of numbers, the non-invasive procedures don't bring you anything. At the end of the day, that's all they see, and it gets you to a point of frustration. Like, they want numbers. Am I going to be a good clinician, or am I going to make numbers for them? So that was a big, like, do I go here? Do I go there? What do I do? So that was also a little frustrating. When the clinic is owned by a dentist, it is an entirely different ball game.
Okay.
So that is another shift which I actually wanted. So then I decided I am not going to work mainly in a corporate where only numbers matter. I don't know how time will be in the future, but I wouldn't necessarily want to be in a polyclinic. But because in a polyclinic, there is most commonly only one dental chair. So again, it comes down to the numbers. But when you work in a dental clinic with 5-6 other dentists, it is an entirely different game. Whether or not you do the procedures, you get to learn a lot. Your growth curves, it goes from here to here immediately, and they understand the procedure, so it is easier for you to explain to them, like, the numbers did not happen because I was trying to actually save the patient's money. I was trying to save his tooth. Now the patient is happy.
When a patient trusts you, they pay from their heart. It's not like, I call it transactional service versus like if you are paying for the service from your heart, it's emotional service. So there's a big, huge difference between these two. So patients pay and walk out, okay, I got my service. But if someone pays from the heart, it means a lot for us. You look forward for another day to come to the clinic.
Exactly. You finish your day with a smile. Even if you've been booked the entire day, that's what should drive you to work every day. This is something that does not actually happen, especially when the game is driven by numbers. It does not really happen at every other clinic, which is kind of upsetting because that also changes the way that you are performing at the clinic that you're working in as well. What I've noticed is, if you're just trying to enjoy the procedure, if you're just trying to enjoy your time with the patient, it is so beautiful. It is so beautiful. You're just being yourself. The patient is also accepting anything you're saying. The patient trusts you, values your opinion, and they leave like, I found my doctor. This transition I've seen happen recently a lot of times when I've put myself at ease, like, it's okay, I'm just going to have a good time with my patient today. I'm going to enjoy the procedure today. And it is bringing such a beautiful difference towards the end of the procedure. The patient leaves with a smile. They're like, you know what? I actually came here because this friend told me and she's so right. You're really nice. I'm going to bring back another friend. And it's so beautiful to hear that no amount of dollars or dirhams can make up for it. This is, at the end of the day, what you would want to work for. Yeah.
So you did mention that you want to work in a dentist-owned environment.
Yes, most definitely yes. A few reasons, which I understood only when I was working in a polyclinic here. Because back in India, I was working in a dentist-owned clinic. It was two main dentists who owned the clinic, and they understood why you needed every material that you needed, to be very specific. So they're like free-handedly giving you the freedom to do anything because they understand what's going on and why you are requesting for so many items. Yes, it is going to be a lot of money, but at the end of the day, the result is so beautiful and the patient is super happy. That's what you actually aim for.
So you're saying, you're telling me like you already had an expectation before you joined Pearl Dental Clinic?
Kind of. Actually, that's something that I told you as well. I really want to be at a clinic where I'm surrounded by great minds, great ideas, which may not happen if you're the only solo dentist at a clinic with 30-40 people. You're having patients every day, but who's to say if you're growing or not?
How did Pearl Dental Clinic change your practice?
Every clinic only sees numbers. Even the clinic may be really amazing, your co-workers may be really amazing, but they never give out their tips and tricks, how they find that connect with a patient. Nobody ever shares that. But that is something that I really liked here because all of us are learning from each other. There is no really, the word would be, I think, there's no bad energy. Everybody wants you to become a better doctor.
There's one more aspect that we can add to it, right? Team dynamics.
Yes.
Okay.
Yes.
And this is, again, in most clinics, most of the doctors are like against each other. But over here, I create a team culture where everybody wants to give to each other. One most important thing that as a clinic, there's no room for experiment. There's no room that we can hire somebody, sit down here, okay, and the patient, because as I told you before, we spend a lot of time, energy in trying to build a reputation for the clinic, and all the doctors over here should perform with the same energy, with the same level.
It's the energy. It's the vibe that you give off. You don't have to be very good at what conversation you're having. It's just the person can feel your energy, that it's nice to talk to you, although I don't understand half the things you say, but I have a nice time talking to you.
Yes.
Yeah.
This is the complete thing, the 360 degrees, where most of the clinics are struggling to keep, one is to attract the right patients, two is to retain their patients, and then they get into the struggle of the number game. Okay, no, I need to pay for my rent, I need to pay the salaries, I need to do this, I need to do that, and then it becomes like chaotic. So it's very easy actually to get out of the mess. Just focus on your patients, do it the best that you can and everything. Any last closing quotes, anything that you want to say?
I really don't want dentistry to be about that. That is something that is going to dump you down. It's not a pretty picture when that happens.
Okay, doctor. Thank you so much for being
You're welcome. Thank you for having me. It was lovely having a great chat with you.
Okay. So thank you so much for watching. I hope you found value and you enjoyed this show. If you have any suggestions, what did you feel? How was your journey into your dentistry if you're a dentist? Or if you have been to any clinic as a patient, what was your experience? Comment in the sections below and we'll pick it up from there. If there is anything that you would like us to share or talk or bring it out for you, please let us know in the comments. Thank you so much for watching.